Hello, my name is Lynn Carter, and I am the Director of Women's Health Services at FHN Memorial Hospital in Freeport, Illinois, Northwest Illinois.
I'm Jenny Wolf. I am the Director of Women's Health Services at Advent Health Zephyr Hills.
We will be introducing our team members throughout the presentation, and this is about the inception and rollout of the Orange Bracelet Initiative, enhancing postpartum awareness and response across state lines.
Our objectives is to implement strategies for an Orange Bracelet post-birth alert system designed to connect emergency medical systems, emergency department, and OB services personnel for the rapid identification of high-risk medical emergencies in a postpartum period. Here is some demographics of our Advent Health Zephyr Hills location. We have 149 beds in a hospital. We do approximately 650 to 700 deliveries annually. We are maternal and neonatal level 1. We have 7 LDR rooms, 6 postpartum rooms, 2 triage rooms, 1 OB, and we are a rural community hospital.
This is FHN Memorial Hospital. We are a 100-bed hospital in a small rural community serving 5 counties. We do approximately 250 to 260 deliveries a year. We're a level 2 nursery. We have 7 LDRPs, 2 triages, and 1 OB/OR.
When we started looking some of our statistics for the state of Florida, it was pretty shocking to see that almost 200 women die on pregnancy-related reasons on a postpartum period or during pregnancy. Leading causes of some of these deaths are hypertensive disorders, infection, hemorrhage, and stroke or cerebrovascular incidents. Black women are almost 4 times more likely to die from pregnancy complications than their white non-Hispanic counterparts. And, it is very important to us to realize that even one maternal death is one too many. We want to make sure that our moms, our sisters, our wives, our aunts go home to their families and to their loved ones. So that's why it was very shocking to find out that this many people really suffer from pregnancy-related complications.
Illinois is not much better. There were last year 88 women who died either while pregnant or within 1 year of pregnancy. 43% of those were due to pregnancy-related causes. And the leading cause of death in Illinois, which is about 32%, is substance abuse disorder, followed by, as you can see, cardiac, pre-existing chronic conditions, mental health, and embolism. And in Illinois, Black women are 3 times more likely to die than their non-Hispanic white counterparts. And the Illinois Maternal Morbidity and Mortality Task Force predicted that 91% of those were preventable.
In October of 2023, my counterpart from Zephyr Hills, Cindy, who you are going to meet a little bit later, we attended to Florida Perinatal Quality Collaborative, and we were working on one of the other initiatives. And there was a family who was kind of there to tell their story. They just recently had their 3rd pregnancy. They had 2 beautiful daughters at home, and with happy, healthy delivery, labor, and throughout the pregnancy, she had no complications. They were in the hospital. They were very anxious to go home, introduce their new baby to the sisters, and just, like we've been there, we've done this, we know what to do, we can go home. And they were discharged. The nurses did educate them, gave them great discharge information and discharge education, but both parents were very anxious to go home, sleep in their own bed, all those things that our patients often, want to do. The postpartum day 3, mom woke up with this mild headache. She was just like, okay, maybe I just didn't sleep very well. The baby was kind of up all night. We nursed a lot. Kind of making excuses for her mild headache. throughout the day, the headache just seemed to get worse and worse. And now she was like, okay, maybe I'm dehydrated, or maybe I didn't have caffeine, or maybe I didn't eat enough. Those typical kind of excuses that we make for our own health, right? And by lunchtime, her headache was so bad that she could barely function. And at this point, her husband was like, okay, we need to go to the ER. We need to take you in. And they got everybody backed up in their truck, went to the ED. He dropped her off at the front door and went to park his car. She walked in alone, went to the ER, went to the registration and said, I'm here because I have this really bad headache. And of course, with a headache, anybody who presents to the ER, you go in the waiting room. She was told to go sit in a waiting room. And just a few minutes later, her husband came in carrying the baby in the car seat. And the person at the registration desk recognized that, okay, maybe there's something going on, more than just a regular old headache. And asked us like, oh, did she just have a baby? And he responded yes, and they immediately went and got the mom from the waiting room into triage. Unfortunately, this mom ended up having a massive hemorrhagic stroke. She ended up being admitted to ICU for almost 3 months. Significant deficits from her, because of the stroke. But had she been left into the waiting room, she would have died. She would have died in a waiting room just waiting. And hearing this story, Cindy and I started talking and we were like, okay, this could happen with us. This could be something that happens in our ER waiting room. It could happen anywhere, in any hospital. And we started thinking of like, what can we do to help our ER providers and our EMS providers to recognize that these moms had recently given birth. And somebody asked the mom, like, what would have made a difference for you? How would have, what is something that would have changed? Maybe you would have gone to the ER a little bit earlier. And only things she could think of was something bright colors, something in your face, like, here it is, do something about this. So we came up with the Orange Bracelet initiative. We decided to do silicone orange bracelets with bold letters saying post-birth alert. That's something that, is very noticeable. And when this family continued to talk, the dad was a 20-year veteran of EMS, has worked in the EMS for 20 years. And he said, I did not know that something like this can happen in the postpartum period. Like nobody has told us that this is even a possibility.
So Jenny and I used to be colleagues for many years, and so shortly after she implemented this program with her team at Zephyr Hills, she called to tell me about it. And 4 months prior, we had a woman that was found unresponsive, brought to the emergency room, and they were doing a full workup on her, trying to figure out what was going on. And about 45 minutes to an hour into her care, one of the ED nurses finally had a minute to look in her chart, and she realized that she was about 3 weeks postpartum. It completely, at that point, changed the trajectory of her care and their focus. She was able to be transferred to a higher level of care, and she was having a hemorrhagic stroke. Thankfully, she had a good outcome, but as soon as Jenny told me what her and Cindy had done, I said, we have to do this at FHN. We're a small rural hospital serving 5 counties. We need this. So I very excitedly took this to my shared governance team, led by our perinatal quality nurse. And I said, what do you guys think about this? And they were so excited. And so then they took on the task of trying to put this together to roll out at FHN.
So after attending to that Florida Perinatal Quality Collaborative and hearing this family story and, coming up with this orange bracelet idea, we really started rolling this out fairly quickly. And we were able to get this out in November of 2023. We started by talking to our ER providers and our ER counterparts. So we reached out to the ER educator, their manager, and started implementing this was like, okay, this is what it means if a patient comes in the ER with the orange bracelet. This is what the expectations for your team are. Then we reached out to our EMS coordinator who is located in our facility, and he hooked us up with the local EMS providers. We did lunch and learns with them, educated the local EMS providers, saying, okay, this is the initiative. We are working on this. Every mom who comes to us and delivers with us gets the orange bracelet. If they call 911 and they have the orange bracelet on, this is what it means. It was received very well. But again, the feedback from the EMS was like, wait a second, moms die after they go home after giving birth. Like we thought they just die in a hospital while giving birth. So again, we realized that there's a huge disconnect between, even between care providers. So then we knew that the general population probably doesn't know this either. And we really wanted to make sure that we're focusing on educating everybody in the patient's room. So educating patient, husbands, sisters, aunts, uncles, whoever happens to be in a room, we decided to do this education with them.
I'm Danielle Wittig. I am the perinatal quality nurse at FHN Hospital in Freeport, Illinois.
And I'm Carrie Schubert. I'm the perinatal educator also at FHN in Freeport, Illinois.
I want to just take this time to talk about how we implemented this program at FHN in Freeport. So once Lynn had brought the idea to the OB Council, I knew that it needed to be a team effort too. I knew we needed to really bring in a lot of disciplines. So we created our team with OB nurses, ED nurses, and at FHN, we have an emergency disaster preparedness coordinator who hooked us up with the EMS in our area. As Lynn mentioned, we have a 5-county area that we serve. So it was very important that we got a comprehensive list of all of the service providers in our area. So we knew that we could close this gap. We could really get into those districts and get that education that they need at their service place. So we developed a 30, 60, and 90-day plan with the goal of implementation at that 90-day mark, which was July 1st, 2024. Some of our team members created an education program with PowerPoint slides because we just wanted to make sure that it was easy for somebody to give the education, since we knew it was going to take a lot of people to get out there and give that education, since we had to meet such a large geographical area. So we developed an education program specific to ED and EMS personnel, and a short education on how the OB nurse is going to educate the patient on wearing, the patient and their family members on wearing the bracelet for that 6 to 12 months when they're postpartum. So one of our team members was able to go out into the community and train each service at one of their monthly education nights. We were able to make it to 15 of the service areas. It was very well received. Same input as what Jenny had here in Florida, that there's just not the knowledge out there. And it felt very, very good to get out there and give them a voice and let them in on what we already know.
So as Danielle led into this, in our area alone, just surrounding our 5-county area, around our hospital, there are 25 ambulance services. So we were able to go out to 15 of those 25, and we're still reaching out to those other providers that we haven't made it to. In Illinois, we are regionalized with EMS. So we started to look at how many services are not only in our area surrounding our hospital, but in our region. So, and that's 80 EMS services. These are rural volunteer community services in addition to very large paid services. So one of our nurses off of our multidisciplinary team actually went out to each of those area EMS services at one of their education nights and provided this education. It was 15 to 20 minutes of just some basic information. These are the high-risk diagnoses, and just went a little bit deeper so that they were aware of it, and then all the specifics regarding the Orange Band initiative. We did see a huge knowledge deficit with the knowledge that most of them assumed it was only a pregnancy related issue and you could not have maternal deaths after delivery. So that led me to develop a education evening. So we had a 2-hour evening session where we invited all of the region back, and I provided education that was a little bit more in depth on each of those 5 diagnoses. And then we held simulations. So what do you do if you get to somebody's house and you recognize one of these issues? And then how can you treat it, or how do you report it to the ED so that you can get the proper treatment? And then that is where we start working on our key recognition and then treatment. So making sure that those EMS providers are calling into the ED that they have a postpartum patient coming, allowing the ED to call up to the OB staff and getting the OB staff available. We don't have an OB-ED in our hospital, so that allows us to get down there and start treatment right away. Through my husband, who's an ED pharmacist, he sits on the Region 1 Advisory Board in Illinois. We were able to get in contact with the EMS our secretary, who allowed us to get on to the Region 1 medical directors meeting. Lynn went over there. She talked about the program, explained everything. There was a lot of engagement. They were very eager to join in on this. So we left there with a standing order that Region 1 medical directors and the whole service is going to be providing onboard training for all new EMS providers and annual education on this program moving forward.
So why the orange color? Like I mentioned before, when the family was asked what would have made a difference for you, she said something bright, something in your face, something kind of obnoxious, and be like, not that you just came from a pool party, but something that would bring attention to, it's like, okay, this is serious. I need to do something about this. So we match this to the A1 post-birth warning signs handout that most of the hospitals are already using. We wanted to make it orange because the color on the poster, the discharge information that we give to our patients and their families, it's the same orange color. This was something that our nurses were already used to talking about. They were already giving those to our patients. They were already in the discharge booklets. And we just wanted to add a visual part, kind of a tangible thing that we can put on the patient's wrist once the education had been provided. So every patient who delivers in our facilities in Florida and in Illinois receives the orange band, the orange bracelet, and we ask them to wear it 6 to 12 weeks, longer if they want to, but the minimum is the 6 weeks. To identify them as somebody who has recently given birth.
Mm-hmm. And at FHN, our bands have black print. Zephyr Hills has red. So either or. The most important part is that it says post-birth alert. It should clearly state those words because those are the words that are going to get people's attention. Once our teams were out in our region in Illinois sharing this program, we realized that there were some EMS folks that worked in Rockford, which is a more urban setting about 40 miles east of Freeport. So we thought, wow, this is starting to really catch on. We've got to get the word out. So we collaboratively hosted a webinar, Lunch and Learn, and shared it with our 3 big hospitals in Rockford. And the one in Rockford that does the most deliveries, about 3,500 a year, they were able to use our education tools that we have provided and put together, which you're going to hear about in a few minutes. And we shared all of that with them, and they went live October 1st. And so it's just really exciting to see the energy behind it because people recognize that this is going to save lives.
Hi, I'm Cindy Mitchell, and I work with Jenny out at Zephyr Hills, Florida, in our very small rural hospital. That we had such a great time coming up with this idea. So as you can see on this screen, the Save Your Life poster is something that we find in the back of our discharge book, and so this is given to every patient. As well as a magnet for them to take home and put on the refrigerator. And we explain why the color of the orange bracelet goes along so well with this poster.
Okay, and also figuring out who your stakeholders is one of the most important starting factors. So for us, developing our team. We had our OB staff, we had our OB providers. We went to all of our provider meetings, staff meetings. We went down to the emergency department, met with the nurses and providers down there. We branched out, as I mentioned, to all of our local EMS. And with each one of those education sessions, we started getting more input, who additional stakeholders were. So then we started going to our OB-GYN ambulatory offices. That way, when those patients were coming back for their early postpartum visits, they could be watching, is that patient wearing her orange band? And if she wasn't, they had their own supply of bands where they could give them the band and remind them to wear them. We also went out to our local community organizations. We partner with the health department, WIC. We have a visiting home nurses program. In Florida, you guys started talking to also your school nurses, jails, the prison system. We did our regional EMS leadership and the boards. And in our community, we have community birth providers that do home births. So we started reaching out to them. They also have a supply also, but they're aware that if they see that orange band, they should be giving them to their patients and encouraging them to wear them for those 6 to 12 weeks after delivery also. But also continue to look for additional stakeholders. The more people that you can find and educate about this, the more important it is, because everybody knows somebody that has had a baby recently. And if you can recognize one of those key diagnoses or problems that are occurring, you can encourage them to seek help early.
So as you can see, we did start collecting data. Once we started, it probably wasn't the smartest thing to start on the Monday before Thanksgiving, but we were so excited to roll this out and see what happened. So by Friday, we actually had our first patient come back, was recognized by her orange bracelet by EMS. They brought her directly into the hospital, straight back through triage and right up to us, had all her fancy little tests done, and found that she had a clot in her brain and in her jugular. So she was admitted immediately over to the ICU and placed on a heparin drip. We've had other patients come in. Since we started this in November, we've had about 72 patients return. And as you can see by the data, we don't admit them all. Some of them will come in with heavy vaginal bleeding. They'll have a little DNC, be discharged home. But they did not come in, what would have happened. So we have really pushed this with our patients, our birthing centers, our EMS, and everybody to really get this word out. You can see where only 7% of the patients who returned did not have a bracelet on. And we did have a funny story. Our EMS called and said we had a patient coming in who had an orange bracelet on. Like, well, okay, bring her on up. So they come up and they're rolling down the hall and we're like, where's her orange bracelet? And they're like, well, she doesn't really have one. It's like, okay, well, how did you know? And it was because they were trained in our emergency room and through our lunch and learns that the patient did deliver a short time ago, but delivered at a whole nother facility that wasn't using the orange bracelet. So it's like, oh, wow. I love getting this word out and having people respond. The biggest reasons for most of our ED visits, you can see on the graph, it's a lot of our high blood pressure, chest pain, vaginal bleeding. So those are the big ones, especially the severe headaches. As you know, when patients come into the emergency room with a blood pressure of 160 over 110, that's not a big deal to them. But for pregnant women, it is. So we continue to collect data and continue to watch and see what happens.
Now we're going to share some exciting data from FHN. And while we've started just a few months later than them in July of this year and deliver a third less amount of patients, we still have had amazing success stories. So we had a patient who came back to the ED with a headache, and the ED registration personnel noticed her band, called immediately for a triage now. And the triage nurse was able to come and get her directly from the waiting room and go immediately back. She checked the patient's blood pressure and it was 190 over 110. and she knew that that required a 15-minute reevaluation. She wasn't willing to wait that 15 minutes. She got the OB provider right on this case and called up. We got the patient transferred up to the OB department, and 2 emergency department nurses accompanied that patient up to the unit. Once they got up to OB, there was obviously something else going on, as how it always goes in OB, and the ED nurses stayed to assist the OB nurse with starting the IV and obtain the blood work. So when it was time for that second blood pressure, it was still high. It was 180 over 94, somewhere in that area. So we knew that she qualified for the hypertension protocol, and they were able to get medication in the patient 22 minutes after she walked into the registration desk.
That's great.
And that is with collaboration and communication that everyone's involved in this patient's care, and that is a huge success story. Another really quick story to share. There was actually a patient who presented to another hospital in a town about 40 minutes away in Rockford, and they hadn't started their program quite just yet, but a patient came into their ER wearing the orange bracelet that says post-birth alert, and they recognized what this said and intervened because of it. So that's 2 success stories right there, and we could even share more. She delivered at our hospital, got the band, went to another hospital for emergency treatment, and got the care she would have gotten at
That's great.
FHN. So amazing, and what an impact.
Yeah.
All right, we've proved our point. We've shown you that this is successful. So now how are we going to help you implement this in your area? Right here on this slide, we have the information for ordering the bracelets. So as soon as you know that you want to go live with this program, get your bracelets ordered. I think they took about 3 weeks, a month for us to get the bracelets once we placed the order. So this is the information here for where we ordered. Feel free to go wherever you'd like. We have no affiliation with this place, but they do send you a coupon once you order from them one time. So we used wristbandbros.com. The color that we used was the 021 orange color. And then the writing is either the bold black or the red, but it's very important, as Lynn said earlier, to have post-birth alert written on the band. That's the message we're trying to get through here. So depending on the amount of bands that you order, they're anywhere from 25 to 55 cents a piece. That large hospital in Rockford, Illinois ordered 3,000, so they were closer to the 25 cents. But the other important thing to consider is you want to make sure that you're ordering 2 sizes. So we ordered the adult size, and I believe it's adult large or extra large, but you just want to make sure that you're ordering 2 sizes so you can be equitable, since every patient's going to get this. You want to think about those patients that are severely swollen and those patients that do have a higher BMI. So make sure that you order 2 size of bands.
And then also make sure that when you're ready to roll out this program, that you're ordering the bands early. As Danielle said, it does take up to a couple weeks. So as we mentioned earlier, we have developed all these resources. As you can see on the screen, here's our flyer that we developed. This is the education we provide to healthcare workers. So the ED, the EMS providers, this is what we take out to them when we're giving the education. It is not for patient care or patient education. So as you can see on the top, there is a big white box. That is something that you can customize with your own hospital sign or your verbiage, whatever you want to add to that. We did have QR codes made, and there is a section on here that does show the QR codes. If you click the QR code, it takes it to our landing page. It gives a description on what the post-birth alert orange band program is, but at the bottom, it includes all the resources that you will need. We're more than happy to share them with anyone, because this will expedite your ability to start this program quicker if you choose to use the orange bands. So You can download the flyer, you can update it with your hospital logo. We have our education PowerPoints, our voiceover PowerPoints. Anything you need to start this program is on there, and use it. That way everybody can be streamlined, you can start it quicker. As we mentioned, one of our neighboring hospitals, we were doing the education to EMS. They share some of those EMS providers. They jumped on board. They were able to get this program up and running in just over a month, because they're utilizing our resources. So please use it. Like I said, we do have a landing page, and the QR code should be in here.
So at the landing page, which is fhn.org/PBA-OB, you'll find an implementation video, an ED and EMS specific YouTube video. There's going to be an OB nurse video, and then again, those downloadable information. So it's an incredible page. Make sure that you get on there and use that, and definitely see what's available out there.
So if you have any questions about implementation or need any assistance at all, you can reach out to Jenny Wolf or Danielle Wittig. That's their contact information. We are more than happy to support you in any way that we can. We are available to do Zoom or WebEx type webinars that we can support in helping educate your teams, or answer questions for your C-suite or anybody else, any other stakeholders who might have questions and want to know what some of the barriers might be, what some of the advantages are. We're here to help support you. So our wish is just that you take this and run with it.
Right.
And so we hope that you'll be able to do that and have a positive outcome for your community and your families.
And keep checking back to that website, because our plan is to really keep that updated. We're going to talk about sustainability. We're going to work through some data points to collect. So that's a working website. So we're going to just keep making that so exceptional and easy for you to use.